So my name's Jules Martinez. I'm the clinical director at Latino Behavioral Health Services, which I'm really proud of. Latino Behavioral is the place, it wasn't a place when I started my recovery journey, but it's the community where I started my recovery journey with Jacqueline Gomez Arias and Teresa Molina, my amazing, beautiful mentors who helped me break some of my own internalized stigma and start on my recovery path and really find a sense of purpose and meaning and community in my life, which were all things that I desperately needed. So I'm proud to support, to promote, to be a part of Latino Behavioral. And I'm excited to be here today to give this presentation on ethical decision making as a peer mentor, which I just got certified as a CPSS. Thanks you, Sarah. So here we go. So first, I know I can't see you all on the Zoom meeting, and thanks for joining us online. But for those of us in the room, how many people, by a show of hands, would say that they are really comfortable with this topic, that they can navigate some tricky ethical decisions that they've had to do at work? Maybe like a third-ish. How many people would say that they're comfortable, by a show of hands, reaching out to your supervisor for support making a decision like this? Nice, that's awesome. Okay. So these are our goals for today. We're going to understand the ethical limitations of peer support, our code of ethics, and some other ethical considerations around HIPAA, confidentiality, trauma-informed care, and cultural responsiveness. So two, to gain some tools in making ethical decisions. And we're going to talk about talking with a team, talking with your supervisor, coworkers, to help us make those decisions, because sometimes that's really challenging. And then we're gonna do a little workshopping. We're gonna work together in some groups to actually we'll go through an example together, and then we'll break up into probably groups of 3 or 4 to talk about problems that you've all encountered in your work, and workshop some of those things together to see how some of these things work, because like all skills, we gotta practice stuff to get good at them. So to do that, I'm going to present some information to you guys in the standard conference way. You love it. And then we're going to go through some examples together in a group discussion, and then again we'll break out into groups. So let's get started. First, I want to say a quick note on values and their relationship to ethics and decision making. So this is something that I'm not sure that we highlight enough. I love that Ryan talked about this morning, but we all navigate our worlds based on the values that we have. And while we have some shared values and a sense of shared morality and ethics, the nuance around ethical decision making is going to be really impacted by our personal value sets, which are going to be a product of our identity, our culture, the lived experience that we have, where we grew up, our age, all of these different things. So I'm going to get into this a little bit when we workshop. There's some research on this too. When faced with an ethical conflict, professionals tend to think in terms of formal codes of ethics, like our CPSS code, and relevant legal guidelines in determining what they should do. We all know what we should do, right? But we're more likely to respond to our values and practical considerations in determining what we actually would do. So there's often a gap between what we know that we should do, what our bosses would like us to do, and what we actually will do when push comes to shove when we're working with a client. And that discrepancy is usually a product of our values, and also like what's possible in the world. So you guys have all seen the Code of Ethics, right? You're all familiar with this. I'm going to pass it out. And for those online, I think that David's going to drop these PDFs in the chat for you as well. So I'm going to present this Code of Ethics. Instead of going in order through the Code of Ethics, I've broken it out just by a few core values that I picked up when I was reading on it. And all of us are going to pick out different values and how these map with our own values or not. And I want us to just kind of be thoughtful about that as we're thinking about these values. So when we go through it, I'll ask you as we go. So the biggest value that I see in our peer code of ethics is choice, autonomy, the many pathways piece where we all find our own way in recovery, and we want to support that for everybody. And that shows up in writing in our code of ethics in a few different ways. So when you guys look at these three that I pulled out based on this choice, what do you all see as maybe overlapping with that value or different values that you see come up here when you read these? Anybody?
And you said what value?
So up there at the top, autonomy or choice, personal choice.
It's all about the person that you're serving.
Yeah, it's all about the peer that we're working with and their choice, yeah. Any other values that you see? So value is like a way of living, a way of being, a way of showing up in the world every day that you highlight. It's something that you work on moment to moment. It's not something that we achieve. So in every session, we can be centering the voice of the peers that we work with. And not dictating a path of recovery based on what we believe is right or what worked for us, but really centering the choice and autonomy of the people we work with. And you see these kind of words, self-direction, their own definition of recovery, all throughout the peer code of ethics. So the use of self and recovery, I think this is another major theme throughout the peer code of ethics in terms of values, that we're talking about our own story, we're sharing our own history with substance use or mental health, and using that to help guide people or to help relate to people or to break stigma in the community. And that's a really unique value set, I think, that peers hold. So I wanted to highlight that one. And then the value of recovery, that we all live in recovery, that we go through this process every day, that's another huge one. So peer support specialists will not abuse substances under any circumstances is one. And we probably need to change the word abuse in there. This is old language, but and that we share our own stories in session. Credibility and honesty. So this is another value that really pops up in the code of ethics, where we want to maintain a professional conduct, and I'm not sure about the word professional, but a code of conduct that helps people feel like we're trustworthy and safe, and that they can come to us, that we're going to maintain their privacy and confidentiality, that we're going to be respectful to others. This one on the bottom around gifts, peer support specialists will not accept gifts of significant value from those they serve. That's another way to build credibility and trust. Because sometimes we don't want our services, we don't want our support to be based on anything that we're receiving from our peer support specialists. We want to know that that's something we're giving equally to everyone that comes to us, and that that's not based on a gift that we received from them, that they're not going to get better services or different services because of those things. So that's why I tied that one in with honesty and credibility. Respect and protection. So this one is pretty huge too. Safety is a primary need for all of us, and it's hard to do any work, especially in the mental health field, if we don't feel safe. It's hard to talk about our histories, it's hard to be vulnerable, it's hard to be open unless we feel safe. And so we have a lot of guidelines around how to promote safety, and how to protect the people that we work with from harm. So respecting the rights and dignity of the people we serve, treating them kindly, not harassing them or using stereotypes or microaggressions or things like that. Not discriminating against anyone, even if they're different from us, is a huge piece, and that's sometimes easier said than done because we all have internalized bias. So that's something that we have to pay extra attention to. Not having dual relationships or conflicting relationships with folks. That can be a hard one in our community. And then not engaging in sexual or romantic relationships with people that you serve. I know this is all review. I'm trying to go kind of quickly. And then advocacy. I feel like we've heard a lot about this value today that the peer community, the recovery community, we value advocacy a lot. We're advocating for ourselves, for the people we work with, for our community. Both in terms of a larger movement in the behavioral health care system and on an individual level. What do we need? What do our other peers need? And advocating. I advocate for my peers with my staff, with my boss, also at the state level, and a lot of us here work on the national level as well. So top to bottom, we're advocating for one another and for ourselves. And then another piece of this is that we have the right to live in the least restrictive and intrusive environment. So this is especially important for those of us who work in the treatment world. Capability. This one didn't come up as much, but I love this piece right here, that we'll keep current with emerging knowledge and relevant to recovery and share knowledge with our colleagues. That's what we're doing right here today. We're trying to stay up on top of our learning and education and skills and research and sharing that with one another. So I think capability is part of empowerment, where the more we know, the easier it is sometimes to navigate systems and get things done. So, the reason I went through it like that is just because when we do this little workshop piece later, we're going to really be talking about values in relationship to decision making. So we're not only going to be using the code of ethics, but we're going to be using our own personal values and kind of comparing and contrasting. When you look at this code of ethics, where do things align with your value set and where do they not align? Because that's going to be the difference between should and would. Like the things you know you should do are outlined on this paper, right? But the things you know you will do are going to depend on those value sets. So if we can try and find out where our values might align with this peer code of ethics, those are the ethical standards that are going to be easy for us to uphold and act on. And if we kind of know where the peer code of ethics does not align with our values, that's where we can kind of see where our hot spots might be, where we might need some support from our supervisor, or where we might need to make a different or more nuanced decision about the way we move forward with things. So when we talk about ethics, there's a lot more than just the CPSS Code of Ethics. We're talking about our agency policies, what's allowable, what's within the rules for our agency, how they would like us to show up. And then we're talking about laws like HIPAA, for example, and mandatory reporting laws. We're also talking about culture comes into play. We're going to talk a little bit about power dynamics, structural power dynamics and social dynamics, and how that can impact our decision making, and also the outcomes, the risks and benefits that people are likely to get based on our decisions. And then trauma-informed care, and how that comes into play with ethics. So in Utah, we are all mandatory reporters. Show of hands, everybody know what that means? Everybody knows what that means, right? I hope so. So we are required to keep a person that we're working with and talking with professionally, we're required to keep that information private and confidential. We can't talk to other people whenever they tell us whatever they tell us, right? But there are some exceptions where we're required by law to report. And this, I think, is the number one like ethical conundrum that comes up for me as a supervisor in my job with my peers. They're always coming to me with these really tricky questions about this stuff, especially working with kids, because kids have no rights, but they should have rights, and we should respect their rights and dignity. But what I mean is legally they have no rights sometimes. So it makes ethical decision making a little trickier. So there are a few cases when we have to report and break confidentiality, and how do we do that? We're going to talk about that. So a child or a vulnerable adult is being or is suspected of being neglected or abused. And a vulnerable adult means an adult who is elderly, so I think it's over 65 these days, or an adult with some kind of developmental disability. A person expresses imminent intent to end their own life. So suicidal ideation is terribly common, but what we're talking about is like, I want to die tonight, I'm going to go home and do this thing. Not, I've been thinking about this thing, it's maybe something in the future. But imminent means, yes, it's going to happen. I have a plan, I have an intention. Or imminent intent to harm another person. So we definitely have to keep people safe and let police or whoever else needs to be involved know if someone has the intention to hurt somebody else. I think we're gonna talk about some examples. So, I don't know, guys, do we want to talk about examples? It's hard to read the room in here. How are you all feeling? You want to do examples? Yeah. Does anyone have an example they want to share of this? Lisa, I'm going to take it over.
Oh no, the microphone. I don't know why it's different standing up there versus being handed it. So I have an example with someone that I was working with that has serious mental illness, and I see this a lot where they're in a home and their family starts to take advantage of them. And they're spending their Social Security money for themselves. And that's a tough spot to be in. And so this gal that I was working with definitely falls under the category of a vulnerable adult. And then you get the nice choice to call APP, or Adult Protective Services, or APS. And so those can be difficult situations.
Yeah, that's a really good example. Thanks, Lisa. Can I ask you a question? Did that person want you to report? So Lisa said no, for those online who couldn't hear. That happens all the time when, especially working with kids or with adults who share this kind of information about their kids. I work with mostly teenagers, and often they'll tell me about their parents being abusive to them. And they do not want me to tell their parents, they do not want me to call CPS, just like this adult might have not wanted. And this is where ethical decision making gets kind of sticky, because our code of ethics says we need to respect the autonomy and choice of our peers. And then this comes in and says, no, by law you do not get to respect that choice. Or people with suicidal ideation and intent, oftentimes they do not want you to intervene when they're very serious. They're like, no, let me go home. They don't want to go to the hospital. They want to be in the least restrictive environment, right? That's another piece of our code of ethics. And so we're like, what do? We have all this conflicting information about what we should do, and what we will do is going to come down to our values. So to be clear, those are cases when you still have to report by law, but it's how you can navigate those sticky situations, the nuance of that I think this becomes really important. So, in that example, Lisa, that you had with the adult, being able not just to end your session and then go call APS, but to be able to have a conversation with that adult and say, by law I'm required, I have to report this, and how do you want to move forward together? And they might not want to move forward at all, but you can do what you can do to include them in that decision-making process and respect their autonomy as much as possible.
falls in line with what you were saying about going to your team for help. So I have a whole team that I can go to as well, right? So we had this conversation, I had these with the peer, right? And then I was able to go to my team for support.
Yeah, that's a really good point. Getting other people involved that can help you work through all of that nuance. So, ethics and power dynamics. This is something that I think is way too often overlooked. We all have power. Some of us have more than others, and some of us are more aware of our power than others, but we all have it. That's what we're trying to do, is be empowered to take care of ourselves and other people. And we want to step into that power and embrace that power and do what we can with it. And we want to be careful about that too, because we don't want to misuse the power that we have. Just as a given, as a peer, we're in a position of power. We're usually working within an agency. We have all of that power behind us. And we're working with people who are, by nature, in a vulnerable space. They're maybe just starting their recovery journey. They have a lot of needs. They don't have a lot of resources. Maybe they don't have a lot of psychological power yet. They don't believe in themselves, for example. So what I would like to encourage everyone to do is to recognize our own power and how that might differ from the people that we serve, and how we can use that to support them, and recognize the impact that we have on them, rather than just throwing it around willy-nilly. So our stage of moral and professional development and our power in a situation impact our values and perspectives on the decisions we make, and it also impacts the degree to which risks and benefits impact us, our agency, and the peers that we work with. And power comes from a lot of places. So we all have social rank, like, because of the way that our society is set up based on our age, and there's like a certain age that's more desirable to be, where you have the most amount of respect from other people. If you're very young, you have no power. If you're very old, you have no power. If you're 20, you're so powerful in society's eyes, right? And you can see that in the media, in the way hiring processes work. There's a lot of ways that shows up. That's just one example. If you present as white, like myself, you have a lot more power. You're seen in a different way than people who present with darker skin. The education that we get gives us a lot of power. If we have more education, we generally have more power. So social rank in all these different categories, those are just a few examples, gives us a lot of power. And a lot of people aren't aware of that, but when I step into a space as a 40-year-old white person, I am often heard more easily, responded to more gracefully than my counterparts who I step into spaces with, who are like women of color, who are younger, for example. They'll say something in a meeting. My girl Monica will just have this brilliant idea in a meeting at Awesome, at the Office of Substance Use and Mental Health. And she just gets on everybody's nerves. She's just perceived in a way, I don't know. I'll say literally 2 seconds later the exact same thing, and everyone's like, good idea. So it shows up and we can't overlook it. Oh, I pushed a button. So we also have structural rank, which I think is a little more obvious to most people. If you're a boss, if you're a peer working with someone who doesn't have a job, if you're high up in your organization, if you're a director, you have more structural power. And we have to be, the more power we have, the more careful we have to be. But also, we have a lot that we can do with it. And then there's people call this different ways, psychological, emotional, or spiritual rank. So our sense of our own power, our understanding of ourselves and what we can do in the world, sometimes can supersede all these other kinds of power. If you have this kind of psychological rank, you can step into a space and people will hear you, and people will know that you're powerful, you know that you're powerful. And this is something that we can all build in ourselves and our peers. So this comes from our sense of autonomy, the experiences and the connection to those experiences that we have in our lives, and our sense of authority or a connection to a higher power. So cultural considerations is something that I also think is often overlooked when we're talking about ethical decision making. So we have this idea of soft universalism. So this is that all cultures, all peoples share basic values and a sense of morality. I don't know that there are very many places anywhere that would condone murder or senseless violence or theft. Maybe people value that in a different level, but most people everywhere are going to value love and connection and safety for themselves and their communities, just as an example. But how these things show up, the nuance of these values, is going to be really impacted by our cultural experience. So we can't assume the degree to which another person holds the same values, ethics, and morals. Does anybody have examples of this that they want to talk about? Yeah.
I think an example would be a mom I was talking with a couple weeks ago and still working with her. We have a great rapport, but it was challenging for me when she was expressing her beliefs. No, it's mentioning values, ethics, and morals. Well, basically her perspective on like the LGBT community and how she wants her son to be raised. And it was hard for me to hear that and not present my point of view and just keeping in mind the whole time, you know, to not react, to respond, and not involve my values and morals. Yeah.
Yeah, that's a really good example. I relate to that. Thank you for sharing. Anybody else have one they want to share?
I had a client that I was working with that had grown up in a gang. Her whole family's in the gang, and their sense of taking care of each other for her to the point of like it was very detrimental to her financially and greatly impacted her recovery because she wasn't able to save for her own, for the things that she needed to, like housing and, transportation and stuff. But it was very important to her that she do this. And so trying to navigate through that and with her without instilling my own, like, do it this way. That was a really hard thing to try to see it from her point of view and then try to work within that construct of her values.
Yeah, that's another great example. Thank you. So finally, I want to just talk about the impact of trauma. And when we talk about, our trauma, our lived experience is going to affect our values and the way that we make decisions and what we think is ethical and moral. Again, not in the big grand way, but in the way that we would do things based on the nuance of a situation. And on the flip side of that, the people that we're working with have likely experienced trauma. And the decisions that we make might have a different or a bigger or lesser impact on them based on that trauma history. And so this is another piece that I really want us to consider when we talk about ethical decision making. For example, I work at Latino Behavioral, and we had an incident when I very first started back this January where a woman came in. She was a referral from the hospital, and she came in and first thing reported that she had been using substances, that she had taken a bunch of her medicine and had taken some meth and with the intention of dying, and that she wanted to die and she didn't want to be there. So, and you could see that she did not look well. She looked like she needed medical care. And we didn't have an emergency contact for her. We couldn't call her spouse, or she didn't have anyone for us to call. And so I made the decision to call the police. The fire department came in, the police came in to our office, where we have lots of, folks who are undocumented perhaps, I don't know, we don't ask about that, but just given that that's part of our community, who have had really terrible experiences with the police. And my own staff had that experience. So their traumatic experiences with the police, I had not considered when I made that decision. I was just thinking, we need to get this woman to the hospital ASAP. She's looking rough. And, of course, everyone was mad at me afterwards because I didn't think about that. I didn't think about the impact that would have on the rest of the people in the building, including my staff. And so again, we need to think about those things carefully because they have a big impact on people. So we've developed in the field of mental health, psychology, social work, and even medicine, across all kinds of different disciplines, over 100 different models for making ethical decisions. And they all have a lot in common, and they all have a lot that are different from one another. And the reason that people are working so much on that is because there's a lot of research that says having an ethical code is not always sufficient for making an ethical decision because of when our values compete. And when we do use a model, it improves the quality and outcomes of the decisions that we make, especially when we're early in our career and we don't have a lot of experience. And to note, the models that we currently have aren't perfect. A lot of critiques have come out about every single model, and some of the big themes around that is that they don't sufficiently address culture or power or bias. So that's why I'm bringing all of these pieces to the table, is because the research really supports that these models are helpful and they're not perfect, and these are the ways that they're not perfect, when we don't address culture, power, or bias. So I think you guys have all seen Mr. Bill White's model for ethical decision making if you've taken the CPSS training. I just took it, it was great. And it's pretty easy to use. Show of hands, who's seen that? Do you guys know what I'm talking about with the boxes? Just a few? Sam's seen it? Okay. So I have something similar that we're going to use. I'm going to show you guys all. That's so loud. And I adapted it just a tiny bit, and I just want us to think about power, culture, trauma. What was the other thing? Bias, yes. When we look at this, and I want us to think about our agency policies, HIPAA, mandatory reporting, when we use these examples. So I'm going to pass this out to you right now. Yes, I am. So if we look at this worksheet, we're gonna do this all together in a bit. But what we're gonna do first is describe the ethical dilemma. What is the situation? Who are the people involved? Identify those likely to be affected by the decision. So I want everyone to push themselves to think outside of yourself and the peer, but also the agency, the community, their family, the recovery community, to think about this as broadly as you can. And then what are the rules, the agency policies, the laws, the different things that you have to, the things that you should do that are going to be part of your decision-making process. Who can you talk to help you guide your way through this? And then we're going to brainstorm 3 to 5 ideas for the ethical dilemma. and go through them based on, so you'll write out the solution or the action that you want to do. For example, after you get out of your session, I'm going to call CPS and report this thing. That's one possible action, for example. Or there's 1,000 million different ethical dilemmas, so this could look really different for each one. Or I'm not going to report, or I'm going to talk to my boss and we'll decide together, or I'm going to talk to the kid. So you're going to try and brainstorm as many different ideas as you can, and for each one, I want you to think about how that lines up with your values. And who that's going to affect. It might look different for each situation. And the benefits and risks to the people that it affects. There might be a benefit to you, but a risk to the peer you're working with, for example. Or there might be a risk to your agency, but a benefit to the peer. And then we'll decide what to do based on that brainstorm. So the first thing I want you guys to do before we go through our first example, on the very back sheet here, there's a piece about values. So before we get into this, I think we need to just take a minute to reflect on our own values. So in the left-hand column, there's a list of Utah's officially outlined recovery values. Well, these aren't Utah's. These are also from Bill White. So they have things like autonomy and choice, advocacy, credibility. So if you would, identify as any of those as your top, we're just gonna pick our top 5, because I bet that these are things we all value. But if these fall within your top 5 values, I want you to circle them. And then on the right-hand side, I would write your other values. So total, you're gonna have about 5, whether you write or circle. And the reason we do this is because we all have a lot of values, but we want to say what's really, really important to us. And that's one way that we can kind of sift through our own values versus another person's values and what's different. So I want everybody to just take 3-4 minutes right now to either write or circle your top 5 values. Okay, so now I want to invite 2 or 3 people to share one of their top values or their top value and why that thing is important to you. For example, my highest value that I have personally, and I don't think that this is on the code of ethics, or maybe it is, on the peer values, is authenticity. It's important for me to show up as my whole real self, because if I don't do that, I feel disconnected from other people. I feel alone, I feel unloved or unseen, and then I feel depressed, and that's when I'm likely to start using substances and isolate and all the things, bad spiral. So for me, it is incredibly important, crucial to show up as my authentic self, to cry if I need to cry, to be angry if I need to be angry, to be loving if I'm feeling loving, and to be super queer, because that's who I am, and I need to do that publicly to feel good and safe and connected. So who else would like to share one of their top values? Steve.
Well, I spoke about this earlier, but autonomy and choice is big with me because it's we're about self-direction. We're about moving on a path of autonomy eventually. It takes time to build it, like I was talking about earlier, but that's probably my number one is autonomy and choice in how I'm going to direct my life, and it also helps me to help somebody else, learn to direct their life and make their choices that they feel empowered by.
Nice. Yes, so autonomy and choice. So knowing that about yourself, Steve, you know that's going to impact your decision making.
Yes.
Who else would like to share? Yes.
I don't like to share, so that's why I share. Openness, because I've learned
about myself that, you know, there's people you don't get along with in this world, and that's okay, but stay open, and there's another side to that relationship and that connection. So openness, I think, is very important, especially in this profession. And humility, which I've also associated with like humbleness, but humility, I like that word better. So those are my top two.
Nice, yes, thank you. So again, those are going to impact your decision making. Anybody else want to share a top value? One more?
Mine would be honesty. Honesty is huge. For me, I think that's the first thing. If I can't trust you, I think it all kind of goes out the door pretty quick for me. So yeah, that's kind of first and foremost for me.
Nice. Great, thank you, Wes. All right, so we're going to keep our values in mind as we do this, as we think about this story and get all meta with it. How do our thoughts about what's happening, how are they impacted by our values and experiences, and how is that going to impact our decision making? So a huge part of being an awesome peer is empathy and self-awareness. They're very connected. And practicing those things is going to help us do better work. So I'm going to share a case study with you from that's kind of a little bit of conglomerate of some of the work that I've done at Latino Behavioral. I conglomerated it on purpose so that it's not as personal, that there's nothing identifying about this person in this story. But it's kind of a combination of different stories that I've been faced with that were similar, so that hopefully nobody knows who I'm talking about. So I'm just going to call this person C. So C is a 35-year-old man. He works in construction and does some welding with a friend on the side to make extra money. He is married with 3 children. 2 are older stepchildren, both girls, 10 and 12, and 1 2-year-old girl who he's had with his partner recently. He started coming to see you after his wife kicked him out of the house, and he decided to stop drinking 8 weeks ago. He's not used alcohol since that date, and he has been working hard on managing his anger and depression. He's going to work most days and taking care of his apartment, so he's not living with the rest of his family. This week, he reports that his wife has not let him see or talk to his children in 6 weeks. He clarifies to say that his wife calls him and asks him for money, and if he cannot give it to her, she won't let him see or talk to the kids. She is cruel to him and talks badly to him, and he feels manipulated by her. He shares that this week he tried to go to her house to see the children, and she threatened to call the police on him, so he left. C tells you that he is thinking of physically taking the kids away from their mother after his 10-year-old called him one day and told him that she couldn't take it anymore living with mom, and that she wanted him to come get them. He asks for your help in getting his kids, saying he's desperate and that they are his only reason for living, and that he will pay you extra money to help him. So as a kind of a group discussion, I want us to identify together, what is the ethical dilemma? What ethical conundrums do you all see in this scenario?
I think the most obvious is taking the kids, for starters. That, you know, we all have cell phones. We see Amber Alerts periodically, and so I think if you knew about that, it's something that, you know, we talked about money. It sounds like gifting in a sense, but it's, you know, there's I don't know, it'd be a tough decision, but I don't think it'd be a tough decision because it's, on my part, it's a choice, and you know, to take the kids, regardless of the situation. I mean, that's what my daughter does for a living. She places the kids. If there's things in a family her up at night sometimes, but, so I, personally, I would be more, apt to blow a whistle. Besides that, when you get an Amber Alert, they're hard to get off your phone. Well, I'm just teasing that.
Thanks for that, Steve. So you're saying there are two that you see. One is taking money from this guy, and two is taking the kids. Yeah. So to be clear, there is no like custody agreement between these parents. They're not divorced. They're separated. Just to throw a little extra nuance into your percolator. But yes, I agree. Totally an ethical dilemma. Other things that people are seeing?
So it's totally triggering like the bias part of me, like having lived experience with children. So that would be like an ethical dilemma for me to pay attention to, is like just listening, I'm like, oh, I want him to take the kids right now, you know? And can't make a decision from that place, so, yeah.
Nice self-awareness there. Yeah, so your personal values and opinion is pushing you in a certain direction, and you're aware that maybe that's not it, maybe it is, maybe it's not. Yeah, but just to think about it. Other things that people are noticing. No? Okay. I think you hit the big ones, Steve, the main kind of overarching ones, the money, taking the kids. Does anybody have questions? Like that you want to know more information about this before you start making your decisions? What questions do you have over there? Oh.
I mean, I do have questions, but I'm not. No.
You're not voicing them?
You had some.
Well, question B, are they in immediate danger for some reason? Either or parent.
Yeah, did you catch the part about the phone call from the 10-year-old girl? Did anybody catch that? Yeah, so why would she say, I can't stand being here anymore? All right, other things, other questions that folks have? You got another one, Steve. You're full of them.
No, I was just gonna say, I mean, I've been in that situation where I can't stand to be here anymore, but that's because somebody made me make my bed or do something, a chore, you know, but a kid's a kid. They're just gonna be like that. And so, there's a lot of discernment to go in there. Yeah.
Yes, exactly. My nibblings call me sometimes, get me out of here, I have to do homework.
So if she did call the cops on him, is there any reason they would matter? Like, is there, custody, whatever, maybe. He could take, I mean, maybe the stepkids might be a little different, but like the child is his, like he wouldn't, there's no reason he couldn't see that child if there's no custody, right? And the cops couldn't do anything. I mean,
Yeah, so you're wondering why did she call the cops and why did he leave and what's the situation with why that even matters? Totally, that's a great question, and I have answers for you I'm going to share in just a second. Any other questions or thoughts or like what's going on with this? Anybody? Okay, so you ask these questions of C, and he tells you that mom yells at the kids a lot, that she often leaves them all day and night alone, and that sometimes she pulls the 12-year-old girl out of school to stay home and watch the 2-year-old so that she can go out of the house. He shares that he doesn't think that she's working and she doesn't know what she's doing all day and night, and that he's worried about it. So just given that little extra tidbit, and I have a couple more for you, but just with that one, what would you guys, what kind of brainstorming, what ideas, what do you want to do with this situation? How do you want to respond to C? What do you want to do? Yes.
I would make him aware that there are resources and that he might need to report, and look for custody instead of thinking about sending an Amber Alert.
Yeah, thank you. Yeah, giving him some options. Yeah, that's a good idea. Any other ideas what you would do with C?
I mean, at that point, aren't we at liberty to report? Because it sounds like the kids are in danger.
I would say you're not at liberty, but that you're mandated. Yes, we're mandated reporters. And it sounds like you have reason to suspect that they're being neglected or abused, or both. So that just throws another wrench in the pile. So what if you also happen to know that C is an undocumented man from Mexico? How does that change the configuration for you all?
A law.
Yeah, do you want to say how?
I would be hesitant to, refer them to certain, thank you. I would be hesitant to refer them to certain resources, depending on what information would be required of C's, just because it could compromise, and he wouldn't even be able to receive some of those resources, so there's a lot to consider there.
I think the trauma-informed care, right, could leading people to re-experience some of that as well, so.
Yes, totally. That totally changes the situation, right? Because if C ends up having to go back to Mexico for whatever reason, then where does that leave the kids? So you're not just thinking about the risks and benefits to C, but also about his family at this point, right?
Also, C is my client, and I know that he has been clean, not using alcohol, only for 8 weeks. No, that's not the case you said. See,
I believe that your client has a very similar history, but this.
no. Did I misheard?
No, you're right. Your client is able to.
I mean,
Keep going.
I mean, see, I'm talking about C, the case,
Okay.
but I'm putting, I'm the peer. It's my client,
No, I wouldn't have done that.
right? I'm thinking my ethical dilemma now. I have him in front of me. I know he's undocumented, and but I gotta keep in mind that he's a person in recovery, and it's in early recovery. So I think I would help him to get a little stronger, and to invite him to be a little patient. But I would also like to know if the wife, the mother of his baby, is a citizen who is abusing him, or is also another undocumented individual. I think that can make a difference. And then I still wouldn't be as afraid of deportation processes and things like that, because the endangerment of the children will take precedence over deportation. So the protection of the children can even help Z stay in the country.
Sounds like you have some experience with this, Teresa. Yeah. So those are excellent points for sure. And then I want to just throw on top of there, and we're going to skip the discussion about this, but just food for thought, because I want to give you guys some time to work on your own. This case, what if you also learn that C grew up in a home with domestic violence since a very young age, and that he was physically abused by his mother as a child, and also beaten and arrested by both Mexican and American police on 2 separate occasions. That bit of information, I'm just going to throw a couple more kinks in the fabric of the universe. So I talk about this case because this is real life stuff, and it happens all the time, and stuff is always more complicated than just HIPAA law or just the code of ethics. It's everything combining together. So what I want you guys to do, I want to spend just 15 minutes, maybe 10 minutes, we'll see how fast you guys go, to get together in groups. And I think, Mari, if you would come up here with Sam and Heidi, and Lisa and Steve, will you join these two right here? And then would you two join this table here with Teresa and Laura? Yeah? And then you guys are one big table and you guys are one big table. And I want you to just throw out as a group a couple of different real life ethical conundrums that you've come across in your work. And please take away any identifying information like names, birth dates, or specific situations or circumstances that are unique to that individual. So you're not going to give anything about their identity away. And share a couple examples with your team. Just do that real quick. Take 2 minutes to do that, and then pick one as a team and go through this worksheet together. And when you do it, pay attention to those things we talked about. Your values, power, culture, trauma. Everybody clear on what to do? So you're going to discuss as a team. If you can share, maybe someone has an example or a few people pick one, and go through this worksheet together. So you'll identify the ethical dilemma, and then talk about, who's going to be impacted by any decisions that you make. Brainstorm some ideas together about what you want to do, how the risks and benefits will play out, and then just go through all the steps on the worksheet. And then our online folks, you're going to have to do this on your own. Just work through this worksheet with an example you have from real life. We're going to do 10-15 minutes. One case to work on together, yep. All right, everybody, I know we needed more time for this, but let's come back together. We just have 5 more minutes to just check in as a group on how this went for you all and what came up. First, can I ask everybody real quick, how much more time do you think you would have liked to work through this problem? 10 more minutes? 10 to 15? More?
I need a class.
You need an hour? See? Okay, that's good to know for myself for planning this in the future. Thank you. So, I know I have too many questions on here to describe in 5 minutes, and I've just been thinking in the last 10 minutes while you all were working. Instead of any of these, I'm curious to know if anyone would like to report back what came up for you when you were talking around power, because that's one thing we didn't discuss as much in our group discussion example. Anybody, what came up for you around power? Whether you
Empower.
So for me, I think, even though we didn't talk about power dynamics, I found I was, even looking at this paper, I'm less inclined to make a choice that puts me in an authoritarian power dynamic. So if I have to do something that strictly follows this protocol, it's the thing I want to back up from the most. I want to look at options, the yes or no's are hard for me.
How does that relate to your values?
So my very top value is connection, and the fastest way to disconnect with somebody is to take away options and to take away their autonomy, their self-determination. So I think that's what it all leads back to for me.
So you're more inclined to do something where you feel like you're sharing power and not being authoritarian.
Yes.
Yeah, nice. Anybody Anybody else? What came up for you around power in your analysis, in your personal experience? Nothing. Okay, what came up for you guys around just like how did this experience feel? How did it feel to go through this? What did you learn or what did you think about? Did it change your perspective at all?
It was very conflicting, the dilemma, the situation I described. But what I will say is that the decision I went with, I felt settled with, you know, and I felt confident in, and it felt like the right thing. And so if I had to put a value on that, I guess it would be genuineness, like doing the genuine right thing.
Yeah, and I think that goes back to our very first slide that we end up doing the things that feel right to us rather than what we should do most of the time in real life.
I'll just say, like, in all of these situations, when we sit down at the table to deal with these issues, it's tough because there's a ripple effect no matter which way you go, right? And I love this idea with attaching our stuff to our decision making to values, because I've never really thought of it that way. And it's going to impact like moving forward in ethical situations, right? And ethical dilemmas moving forward. Because I found with the power piece too, like we don't like to see people hurt either, right? And so that we kind of talked about it yesterday too, like the need to want to jump in and fix, right? But now it's like, whoa, take a step back and like look at that ripple effect and yeah, I love it.
Thanks, Lisa. We just have 1 more minute left, and so I want to just thank you all for being here with me and engaging in this process with me, especially the group discussion. I think it's so much better when we talk together than when I just talk at you. It's easier to integrate everything into our real lives and work. Thanks to all of you, and if you have any questions, you want to talk about anything anymore, my contact information is there. Feel free to come up. I have cards. That's old-fashioned, but that's how I am. And I hope you all enjoy our last keynote of the day and that you enjoy the conference, and thank you for being here.
Thanks, Jules.